you. So just a small dose of reality as we kind of enter this meeting. And next, I'm going to introduce Dr. Victor Dzau. He's the president of the National Academy of Medicine, formerly the Institute of Medicine. In addition, he serves as the chair of the Health and Medicine Division Committee of the National Academies of Sciences, Engineering, and Medicine. He's the Chancellor Emeritus and James B. Duke Professor of Medicine at Duke University, and the past president and CEO of the Duke University Health System. Previously, Dr. Dzau was the Hersey Professor of Theory and Practice of Medicine and Chairman of Medicine at Harvard Medical School's Brigham and Women's Hospital, as well as the Chairman of the Department of Medicine at Stanford University. Yes, thank you.
Good morning and welcome. Is this on? How about this one? Adam, what did you do? You running away with it? How about this one? Oh, there you go. So Adam, first of all, thank you. Thank you for bringing a real story from Appalachia. And I think it's a really great way of starting today, because I think it's going to be a very special day. Special day for me, for the Academy, and for all of you, and for all the reasons why we're here. Because it's the common reason we're here is because we care about this issue, care about our people and their health. And so I want to begin by first thanking Kimber and her team putting together a dynamite program. She's a real drill sergeant. You hear that we're going to be rapid firing, trying to go through the day. But I think it's going to be rich. It's going to be productive, interactive, and there'll be lots of things we learn from each other. You are our allies, stakeholders. That's why you're here. We talk about a culture of health movement. I think that's what it's about. And we at the National Academy are very, very excited about having a role in this. Thanking, of course, our partners, Robert Wood Johnson Foundation, Dwayne Proctor, Kim Elliott, and soon Jim Marks will be here. Oh, Jim is here. Jim, welcome. You know, I remember just before I started this job, a call that I had with Risa Lavisa-Mori, who's the president and CEO of Robert Wood Johnson, and my predecessor, Harvey Feinberg. And we were talking about this concept of doing something in National Academy in Culture of Health. And of course, with a generous support, now we've launched this program. And I think this program is a multi-year program, as you know, which is going to be very exciting in looking at ways to address culture of health from the lens of evidence, from a lens of learning, and from the lens of everybody who's engaged in this work. So you already heard that we started this journey a little bit over a year ago, and 2 weeks ago we released the first report called Communities in Action, Pathway to Health Equity. And I want to first give credit to Rose Martinez, who's here, and her team, as well, of course, the committee, which includes today, I mean, Helene Gale's here. Helene, where are you? There's Helene. Hello, Helene. And also Alison Kayla, who's also here. And you're going to hear some more about this report, but I will tell you, it's impactful because it starts our journey. It starts our journey about what we're trying to accomplish. And I learned a lot reading the report and hearing the committees talking about this and the recommendation at time of release the report. What did I learn? Health equity. It's crucial. Health equity is crucial because it's fundamental to the idea of living a good life and building a vibrant society. Health inequity is costly. And of course, it's a huge problem in this country and continues to be a problem for all of us. It's costly not only on the issue of healthcare costs, but it costs the entire society. Jobs, productivity, economy, and so on and so forth. What else did I learn? Addressing health inequities need to get to root cause. And you're going to hear about the root causes. It's very provocative, but at the end of the day, it is about poverty, it's about structural racism, it's about discrimination. And until we can address these issues, we'll always have health inequity. However, there are solutions where communities come together to address them together. The allies, if you will, in having people from all parts of the community, not just healthcare providers, to come up with solutions. And this report gives 9 exemplars of how communities can come together to solve this problem. And I think what's really exciting for me is the encouragement you can get from seeing what people are doing and the opportunity for people to learn from these lessons. And so a big part of what we want to do here at National Academy is to take this report and to make it not only available, but make sure it gets to everybody's hands. A lot of things we think about how to disseminate this report, including the idea of having a repository of information for people to say, if I'm in this community in Appalachia, how do I do something like this? How do I get people together? How do I learn? We hope that people will come to this report, this Cultural Health program, and to say, I want to learn something. Not only can I read those reports, but can I come and learn about this? Can I connect with people and begin to try to build from the lessons learned? I think this is truly very exciting. This past weekend, we have the opportunity for, a great movement. My wife was here, and, we went to the Women's March, and I saw this big sign, and of course, you know this well, the Martin Luther King statement that says, and I'll read it to you, of all forms of inequality, injustice in healthcare is the most shocking and inhumane. We are going beyond inequality. We're talking about health equity, going beyond healthcare. How about really the social, economic, and many factors that determine health? So my feeling is, with all of you, we have great opportunity to succeed. And let's make this a movement. Let's just make sure that we continue this journey. So where are we going from here for the Academy? Well, we have a multi-year plan supported by Robert Wood Johnson Foundation. We hope this plan is just going to keep going for a long time. But importantly, we want to ask ourselves, beyond identifying the issue of health equity, beyond identifying the root cause, beyond finding exemplars, what do we want to do? And that's why you're here. You're here to help us think through this, and an illustration of the cases we hear today can help us, that is, the National Academy of Medicine, the Advisory Committee, and Robert Wood Johnson say, what are the things we need to take on to complete this journey or to continue this journey? So I'm very excited about the programs today. You're going to hear about homeless children. You're going to hear about early childhood, the science behind how inequity affects development. You're going to hear about communities and how, in fact, now the government's thinking about or launching this program called Accountable Care Community. You're going to hear about the use of information data to plan how to move forward with these many activities. And of course, you're going to hear about how health equity across the settings and sectors. So I just want to welcome all of you because I do think this is a very exciting day. It charts an important day for our journey, and we look forward to working with all of you going forward. Please feel free to interact, speak up, and then, of course, Kimber will crack a whip to make sure we're on time. But I will say this again, this is a really, really important issue for us at the Academy and for me personally. Thank you.